Joining us on the BIN is Surgeon General Dr. Vivek Murthy. Thank you so much for joining us on the BIN.
Of course, I'm glad to be doing this, Esther.
Oh, top of mind for a lot of people this time of year is the holiday season and getting together with family and friends. People are concerned about COVID. They're concerned about the flu, RSV.
Hmm.
How can people, I guess, best navigate what they should be focused on and how to protect themselves and the people around them as the winter holidays approach?
It's a great question. And as the holidays come, look, we want people to be able to see the folks they love and to be with family, especially after the last few years during COVID, when many of us, especially in the beginning, weren't able to see our loved ones. I think we recognize just how important that time is. The point is also, though, that we want to do that safely. And the good news is that we have a better sense of how to gather safely, better now so than we did, two years ago. So here are the key things that people need to know. Number one, it is true that there are a lot of respiratory viruses that are circulating at high levels right now. Probably heard not just of COVID, but RSV, the influenza has started off early this year, and there are other viruses that are circulating. I know this not only because I'm Surgeon General, but because I have two small kids who are in school, 4 and 6, and I'm seeing that firsthand. But the good news with COVID is that there is an updated vaccine that you can get that can reduce your chances of getting severely ill, of ending up in the hospital due to COVID. That's really important. With influenza, with the flu, there's also a vaccine that you can take. And the good news is you can get the flu vaccine and the updated COVID vaccine at the same time. RSV, unfortunately, we don't have a vaccine for RSV, but we do know that it spreads the way other respiratory viruses spread. So making sure you're washing your hands, making sure you're staying away from folks who are sick and staying home if you yourself are sick. These are important parameters to follow as well. And finally, just keep this in mind. It's not only vaccines that are important, but if you do get sick, I want everybody to know that there are treatments available for COVID as well as for the flu. And we also have tests that are widely available now that are covered actually by your insurance plan. You actually you're able to get a certain number of tests every month. Covered by insurance, and you can use those tests before you gather, just as an additional layer of security to make sure you're not bringing the virus in and exposing your loved ones. And finally, just keep this in mind: masks have been useful throughout the COVID pandemic to reduce the chances of spreading the virus. And especially if you're at higher risk, you're going to be with people who are higher risk. Then sometimes that can be an additional tool that you can use to make gathering safer. So we put all of this together and we see that we have more tools now to gather safely than we did before. And the bottom line is if you get vaccinated, if you're up to date with your vaccines for COVID, if you reach out for treatments, if you do in fact get sick, treatments like Paxlovid, especially if you're higher risk, your chances of ending up in the hospital and dying from COVID-19 are dramatically lower than they were at the beginning of this pandemic. That's a really good thing. It's evidence and basically thanks to the incredible work that scientists and nurses and doctors and public health experts and community leaders have done all across our country.
I wanted you to talk a little bit about how you are trying to convince some of these people that are hesitant to get the updated vaccine. What would you say to them? Some may be worried about not just their health, but also cost.
Well, I'm glad that you asked because we have worked really hard to make these vaccines as easy to get as possible and to lower as many barriers as possible to getting them, including cost. So the COVID-19 vaccines, including the updated vaccine, are free of cost. And they're also available at tens of thousands of pharmacies all over the country. In fact, the vast majority of people, 90% of people in the country, live about 5 miles or less away from a pharmacy that has a vaccine. And you can get the vaccine also at many doctors' offices. We've worked really hard over the last year and change to make sure that doctors have the ability to get this vaccine in their office and administer it directly to their patients. So the bottom line is there are more ways to get the vaccine than ever. It is free of cost, which is really important. And that's one of the reasons we want people to go out and get it. You can go to vaccines.gov, you can go to covid.gov, and you can type in your location and find a place right around you where you can get vaccinated. And finally, just think about this. If you're wondering, gosh, do I really need this vaccine? I've gotten vaccinated in the past, or maybe I had COVID, earlier, a year ago, 2 years ago. Do I really need this? Here's what I would say. We know that reducing your risk of COVID is something that vaccines are very good at. But like with other vaccines for other illnesses like the flu or like tetanus or for other conditions, Sometimes you need a booster from time to time. Sometimes you need an additional shot to continue and sustain your protection. It's one of the reasons you get a flu shot every year. It's one of the reasons every few years you get a tetanus shot. With the COVID vaccine, one of the things we've realized is if you did have a vaccine early on, that did give you some protection, but over time that protection can wane, and particularly if you're older, if you're 50 years of age and above. So staying up to date with your vaccines is really important, and that's why I want everybody to go out and get that updated vaccine. Here's who's eligible. If you are more than 2 months out from your last COVID shot, you are eligible to get the updated COVID vaccine. And if you recently had the COVID infection, it's okay for you to wait about 3 months before you get your next your shot, your updated COVID vaccine. But the bottom line is, tens of millions of people have already taken the updated shot. In the push to get more people to take it, we want to keep Thanksgiving in mind. That's the time when a lot of people are going to be gathering with family and friends. So make sure you get your vaccine today, so your body has time to build up protection from that vaccine. So by the time you arrive for Thanksgiving, you'll be in as good a shape as possible.
I know you mentioned that you can take the COVID vaccine and the flu shot together. Do you believe that the COVID vaccine will become an annual vaccine?
Yes, and just to reiterate, you can get them together. That's what I did. In fact, I got them both at the same time, and did just fine. I do think that for many people, the COVID shot will likely end up being an annual vaccine. There are some people, those who are high at risk, like the elderly, for example, who may need more than one vaccine a year. We'll know that with time, as we see how people respond to these vaccines and how the protection holds up. But the bottom line is, again, if you stay updated with your shots, if you make sure that you reach out to either your doctor or go to covid.gov to find treatments, if you do in fact get the virus, your chances of dying from this virus are dramatically lower than they were in 2020. And that's progress I think that we should all be happy about, we should know about, and certainly should be proud of.
Is this vaccine, this updated vaccine, safe for pregnant women?
I'm really glad you asked that, because it's not only safe for pregnant women, but it's even more important that pregnant women are up to date on their vaccines than folks who are not pregnant, because what we have learned is that getting COVID when you are pregnant puts you at increased risk and also puts your baby at increased risk. And look, I have two small kids, and it's very still fresh in my memory when my wife was pregnant, and when we were being so cautious of trying to figure out how do we make sure she gets through this pregnancy, that she's safe, and that our kids are safe. And so I know that people out there, families want to do everything possible to take care of the health of a mom, during pregnancy, and the baby as well. And what we've learned through the data is two critical things. One, these vaccines are actually very safe during pregnancy. They do not cause any miscarriages. They do not cause birth defects. They do not cause increased risk of complications for the mom during pregnancy. Instead, what we have found is quite the opposite, which is that the vaccines reduce the risk of a mom experiencing severe illness because of COVID, if in fact they do end up getting the virus. The vaccine, in fact, also allows for antibodies to COVID, which are those are the proteins in your body that help protect you from infection. That's what a vaccine helps build up in your body. When a pregnant mom gets vaccinated, there's increased likelihood that she will then pass on those antibodies to the baby, both during pregnancy and then afterwards when breastfeeding. So the bottom line is, protection for the mom, protection for the baby are both a result of getting vaccinated during pregnancy. So I would say, if you are either pregnant or if you know people who are pregnant, please encourage them to get vaccinated. They are certainly at higher risk of complications of COVID than people who are not pregnant. So we want to make sure they have all the protection that they need.
I still have family members who are very hesitant to get the vaccine. And this is a part of the Black community. It definitely is something that is conversation, at least among family members of mine. What are you doing, I guess, to reduce that vaccine hesitancy in the Black community?
First, look, I just want to say, if someone is hesitant about getting vaccinated, they have questions, it's okay to have questions. It's okay to want to know more, to want to understand, a little bit more about these vaccines before you get treated or get vaccinated. But here's what I would say. Like, number one, I think it's really important to listen to the questions and concerns that people have. It's also important to share with them, like, your own personal experience. If you got vaccinated, letting a family member or friend know, that's really important, because we know that in a moment like this, people are trying to figure out what to do. Hearing from people they trust, like their family members, their friends, their doctors or nurses. That's really, really critical. The third thing I would just share also, though, is that we have tons of information, tons of data and evidence now about how safe and effective these vaccines are. Keep in mind, we have given this vaccine now to hundreds of millions of people in the United States and to billions of people all around the world. And when the more and more we look at the data and analyze it, there are two critical things we see. Number one, these vaccines have been remarkably effective at saving lives. It's the most important job of the vaccine. Even if you get vaccinated, you may have, a breakthrough infection, but the key thing is that it prevents you from dying, and it dramatically reduces the likelihood that you end up in the hospital. Again, that's what we all want. But the second thing that we've learned, Esther, is that these vaccines have a remarkably strong safety profile. I was discussing this, in fact, with some of my medical colleagues who have seen infectious diseases for decades and decades, who have fought against, some of the big outbreaks we've seen in our lifetime, from, previous, sort of SARS infections to Ebola to even the polio, sort of a virus when it surfaced more than half a century ago. And when they look at this data, what they say is that this is really remarkable, the effectiveness and the safety of this vaccine when it comes to preventing deaths, and again, doing so in a way that's safe. And so, what I want to just remind people is that this is not an experimental vaccine. This is a vaccine that has a proven track record. It's a vaccine that has shown us that it can protect us and it can do so in a way that's safe. And that's why we're encouraging everybody to go out and get this vaccine. Keep in mind that people 6 months of age and up can now get protected with vaccines against COVID-19. And that's why, this is a moment where, with a combination of vaccines and treatments we have, very, very few people should be dying from COVID-19. What worries me, Esther, is that there's a lot of misinformation out there that has led people to think either the vaccines don't work or that they have terrible side effects, neither of which are true. It's our job as friends and family members, as leaders in the community, as nurses, doctors, public health experts, to make sure we're doing everything we can to help people get accurate information. And that's the last thing I would just say, is encourage your friends, if they've seen something online or on their social media feeds that raises questions about the vaccine, ask them to be mindful of the sources, because there is a lot of misinformation floating around. Encourage them to talk to their doctor, encourage them to go to their local Department of Public Health, to check out the CDC site, to check their local medical society. But you go to a trusted source to get the information, because it's really critical that the right information informs our decision making, because this is a life or death matter.
It is. Well, my final question is, you recently announced a new framework on mental health and workplace well-being. What was your, I guess, most important discoveries that you made doing this work?
Well, I would say the most important takeaway message from our work on, on our recent framework on mental health and well-being in the workplace, is that the workplace affects our mental health in profound ways. And that shouldn't be a surprise, right? We spend nearly half of our waking hours, if we're working full time, in the workplace. The people we interact with, the work that we do, the culture and environment in our workplace, these all impact how we feel. And if we think about it, we all know that, right? When we have a really tough day at work, we know it can impact how we show up for our family and our friends. And similarly, when things go really well at work, it can also positively interact how we show up for other folks in the rest of our lives. So the workplace is profoundly impactful on mental health, but that means that we have a real opportunity here to think about how to transform the workplace into engines for mental health and well-being. Why does this matter so much? It matters for individuals, many of whom are struggling with mental health concerns right now. And on surveys, nearly 80% of people are saying that their workplace has had a negative effect on their mental health. And a similar number are actually saying that they want to prioritize mental health in the next workplace that they look for. So that's a critical thing that workers are telling us. But we also know for workplaces, for organizations, mental health is critical, because when people are doing better in terms of their mental health, they are more productive in the workplace. They're more creative. They're more likely to stick around, which reduces turnover costs, improves retention. And all of this is very good for the organization as well. So it's a win-win for workers and for organizations to invest in mental health and well-being. And that's why in the framework that I laid out a few weeks ago, I identified 5 essentials that form the foundation for mental health in the workplace, that include protecting people from harm, ensuring that we build social connection and community in the workplace, investing in ensuring that people have opportunities to grow ensuring that they have a balance between work and their life outside of work, which includes respecting those boundaries so that people can have time with their family, have time to recover. And finally, the fifth essential is ensuring that people know that they matter and that their work matters. There's so many people who aren't sure if they're really contributing any value, or they're not led to feel that they or their work has any significance. It's important for us to make that connection, because all of us need community, we need meaning, we need support, we need an environment that provides us with the tools that support our mental health and well-being, so that we can be well and we can also contribute the most to our workplaces.
Well, this has been a really great conversation, and a lot of things that I've learned, and I'm sure our audience can take away a lot of information. We appreciate your time. Thank you so much, Surgeon General Dr. Vivek Murthy, for joining us on the BIN.
Thanks so much, Esther. I really enjoyed talking to you today.
I'm Esther Dillard on the Black